There are a lot of myths associated with breastfeeding, so let's explore a few. One of the things that I get asked very often is if I'm sick, if I have a cold or a cough, can I breastfeed? Now, it's very important, in fact, to continue breastfeeding even through an illness. We know that when the mother falls sick, her body produces antibodies to fight that illness. So, for example, even if you're down with COVID, it's a viral infection, your body is going to start immediately producing antibodies to fight that virus. Now, these antibodies are passively transferred to your baby, and it's going to be protective of, maybe baby will still fall ill, but the severity of that illness will be much less because your baby has the coping mechanism to fight that illness or disease. So it's very important to continue to breastfeed, and it is, however, important to wash your hands often when you care for your baby as you're sick. Make sure that you wear a mask and breastfeed as you normally would, and give your baby as much exposure to your breast milk because that is very protective. In fact, even if you have mastitis, or even if a mother has breast infection, she can continue to breastfeed in spite of it, and it is not going to harm the baby in any way. So another question I get is, if a mother continues to breastfeed, is she going to drain her own nutritional reserve and become weak? This is not true at all. Breastfeeding does involve expending a lot of energy. It does involve burning calories. But it is important for you to nourish your body, eat healthy, hydrate in order to maintain the process of breastfeeding. As long as you're eating healthy, just like you would if you were exercising, you have to ensure that your food is supportive of the process of breastfeeding. It's also going to enrich the quality of breast milk. But if a mother continues to breastfeed past 1 year, even past 2 years, it does not mean that it is going to drain her own nutritional resources. In fact, extended breastfeeding for up to 2 or 3 years, in fact, is protective of certain reproductive cancers like ovarian cancer, uterine cancer, and even breast cancer. So it is important for moms to continue to breastfeed for as long as they're happy and comfortable with the process, and for as long as baby is enjoying the process of breastfeeding. Will breastfeeding make the breast sag? It is not the process of breastfeeding, but it is a result of age and gravity. So when you breastfeed, the breast fill in with milk. The milk-making glands are going to get bigger. It's going to get heavier. The weight of the breast may cause some traction or stretching, and all the ligaments, they're called the Cooper's ligaments, which hold the breast up in position. So with breastfeeding directly, there is no real direct effect on the breast sagging, but because of gravity and because of age, this is a natural process. It is important to wear a supportive inner garment in order to keep the breasts closer and to prevent the effect of gravity from overstretching these ligaments. And that is going to protect you to some extent. Besides that, the breasts normally go back to their original size by 8 to 9 months after having given birth. So even though they look 2 cup sizes larger, by 8 to 9 months, they're going to go back to their original size. Now, you have to also understand that the breast is almost 70 to 80% fat. So if you are going to work on losing weight in a healthy and sustainable way, work on the muscles, that is the pectoral muscles underneath that fat layer, it is going to help with lifting the breast up and regaining its, maybe not its original shape, because with age that's the extent to which we can have control on it, but it will definitely help. So it is not true that breastfeeding is going to cause the breast to sag. So let's support breastfeeding. Happy Breastfeeding Week.